What is medical necessity in the Medicare appeals process? Imagine you're trying to get a treatment or service covered by Medicare, but it gets denied. You might wonder what makes a service qualify for coverage. That's where medical necessity comes into play. It's a key part of the Medicare appeals process. Medical necessity means that a health service, treatment, supply, or prescription drug must be essential for preventing, diagnosing, or treating a medical condition according to Medicare's rules. It's not just about whether the service is helpful, but whether it's appropriate and effective for your specific health issue. To be considered medically necessary, the service must be directly related to diagnosing or treating your condition. It should be provided to help manage or cure the illness or injury. The service should not be mainly for your convenience or the provider's ease. It must follow generally accepted medical standards, which are guidelines that most doctors agree on. When Medicare denies coverage because it says a service isn't medically necessary, you have the right to appeal. During the appeal, you can ask Medicare to review their decision. Your healthcare provider can help by submitting detailed medical records or a letter explaining why the service is needed. This documentation should include your diagnosis, treatment plan, and why the service is appropriate. The process starts with a redetermination by a Medicare administrative contractor, which is a regional Medicare office. If you don't agree with that decision, you can ask for reconsideration. If needed, the case can go to a hearing with an administrative law judge, then to the Medicare Appeals Council, and finally to federal court if necessary. Medicare uses guidelines called national coverage determinations and local coverage determinations to decide what's medically necessary. National coverage determinations are federal rules that apply nationwide, while local coverage determinations are regional rules set by local Medicare contractors. These rules help decide if a service qualifies for coverage. In the appeals process, healthcare providers can support your case by submitting detailed medical records and explaining why the service is necessary. It's important to gather all relevant documents quickly and follow the appeal instructions carefully, usually within 120 days of receiving the denial. Understanding what qualifies as medical necessity helps you know your rights. If Medicare denies a service, you can challenge it by providing more proof that the treatment is needed. Working closely with your doctor to document your condition and the reason for the service can make your appeal stronger. In the end, medical necessity is about making sure Medicare resources are used for services that truly benefit your health. It also gives you a clear path to fight for the care you need when a claim is denied. Remember to review your Medicare summary notices regularly, gather supporting documents promptly, and follow the appeal steps carefully. If you need help, Medicare advocates and counselors are available to guide you through the process.